Many women experience pelvic pain at some point in their lives, but for some, it can be indicative of a more serious problem.
The World Health Organization says 1 in 10 women have endometriosis. But what exactly does that mean? Bridget is standing by now to ask a doctor.
Although pelvic pain can relatively be common for a variety of reasons in women, it's not necessarily something you want to ignore. For some, it can be a sign of endometriosis. And that's why we have Dr. Mark Trolice here, a reproductive endocrinologist with Oviedo Medical Center. Thanks for coming in.
My pleasure. Thank you for inviting me, Bridget.
Well, we know this is very common, but it often goes undiagnosed. Why is that?
Well, because probably two things. One of it is awareness from the physician. And the second is that it requires surgery typically to make the diagnosis. Do you know from the time that a woman has symptoms until she gets diagnosed could be up to 10 years? And she's suffering for all that time. Now, the only time that you could probably make the diagnosis without surgery is when ultrasound or MRI can see these cysts of endometriosis on the ovary itself. Okay, and that's called an endometrioma. But the real question is, what's endometriosis? It's the normal lining of the uterus. You know, every month a woman builds up the lining and then sheds. That's their period. But it's the normal lining of the uterus anywhere in the body it's not supposed to be. And do you know that that normal tissue of the lining of the uterus has been found in every organ system of the body?
Those cells are everywhere.
Can be spread to those other places. Women could have in the lungs, in the brain, and now recently in the spleen, finally.
So they're finding more connections there. Do we know what causes this? Why some women, struggle with this condition? Because it is painful.
Great question. And the most prevailing theory, Bridget, is that while the menstrual flow is out through the vagina, it also can go back through the tubes and implant, most commonly in the ovaries, but it could be in the fallopian tubes, it could be in the pelvis, it could travel throughout the intestines and cause severe pelvic pain. Endometriosis is associated with two chronic problems. One is pain, and the other one is infertility. Up to 50% of people with endometriosis, women can have infertility, and up to 50% of patients who present with infertility can have endometriosis. It is a debilitating disease. 190 million people in the world is estimated to have endometriosis.
Many times that's when women find out more about this is during their fertility journey. So what can you do to get through that to, have a successful pregnancy?
Well, that's a great question. And the treatment of endometriosis is really based on what the woman is experiencing the most concerns with. Is it fertility or pain? If it's pain, then you're taking a look at surgery. And you really should be seeing a pelvic pain specialist to do that kind of surgery. The first line treatment for endometriosis is typically anti-inflammatory medication and the birth control pill, which can keep estrogen at bay because it's an estrogen-dependent disease. For infertility, you don't really have to do a laparoscopy unless there's a suspicion of very advanced endometriosis or fallopian tube blockage with that concern of endometriosis. But if you're going to be doing, say, something like in vitro fertilization, which is a very advanced assisted reproductive technology, you don't really need to do surgery before that time. But surgery may help a woman be able to conceive naturally with endometriosis and reduce her pain.
What happens during that surgery? What do the doctors do to improve the condition for the uterus?
You really try to remove it or excise the endometriosis as much as possible. If it's a cyst on the ovary, you don't just drain the cyst, you really go into the ovary and remove that cyst. Now, the good and bad of that is, yes, you're removing the cyst, but you're also removing some healthy ovarian tissue.
So there's some risk involved.
Well, you can accelerate ovarian aging and women can lose their eggs. So they may even want to do some fertility preservation to freeze their eggs if there's a concern that they're going to be doing extensive removal of endometriosis of the ovaries.
Okay. And so when it comes to, the awareness, this is the awareness month, what can people do to just try to find out more about this if they suspect that they or one of their loved ones might be experiencing endometriosis?
Terrific question. And there's advances in endometriosis. Just a few years ago, the FDA approved an oral treatment to suppress the signals of the brain to the ovary from making estrogen.
Okay.
And it's a GnRH antagonist, and it's seen good results. Awareness is key. Okay, the Endometriosis Association, women can find a lot of information about that. The American Society for Reproductive Medicine is asrm.org. The American College of OB/GYN, acog.org. So empowering women with their disease is key for their compliance, their understanding, and to reduce the anxiety.
Well, it's good to hear there are more and more resources. Thank you, doctor.
My pleasure, Bridget.
Yeah.